Thank you, everyone. I'm Yazmin Garcia Rico, Director of Latinx and Hispanic Policy and Strategy at the North Carolina Department of Health and Human Services. And Dr. Viviana asked me if I could give a quick update on things that are going on at DHHS. Dr. Gonzalez Guarda is going to help me to share a few slides. It is a brief update. There are some things that are not included here that I would also like to share with the group. So I will probably start with other updates that are not on the deck. And I will be putting on the chat a link to the most recent noticias that went out last week, which is a bilingual newsletter that we send out every week and a half or every week. The following items that I will be mentioning are on this newsletter. We posted a couple jobs to support the Latinx Hispanic work here in the department working with me. So we have a project manager position open, and the link for more information is in the noticias. If you know strong candidates that would be a good fit, please help us to spread the word about this position. And the second position is an administrative assistant. And so ideally, we're looking for bilingual, bicultural folks that can support this work and continue to build the team here within the Office of Health Equity and specifically my work. I will be moving into the deck probably now. And so if we can move on to the next slide. So we have a Cafecito, which is a Spanish language virtual event that will be taking place tomorrow, Thursday at 6 p.m. So we welcome you to join us. This is gonna be shared on Facebook, Twitter, YouTube, and also people can access it via phone for a few months or probably more than months, years. I'm not really sure for how long, but we have been adding a teletown hall component, which is basically we sent a phone call to people who identify as Hispanic throughout the state the day before the event to let them know that this conversation will be taking place. And then we send another robocall the day of the event. So people have the option to tune in via phone, and they can also ask questions of the panelists by pressing 0. This is a way that we're trying to reach people who might not have a strong internet connection. The whole event will be in Spanish, and we are focusing this month on a couple topics because it's awareness month for these two topics, which is men's health and the LGBTQ community. So we're trying to weave in the conversation these two topics. We'll have Orlando Martinez, who I know recently spoke at Latin 19 a few weeks ago, from El Centro Hispano, and he will be participating. And also we have Krister Brady, a doctor from a community clinic in Prospect Hill, part of Piedmont Health Services, who also speaks Spanish. So we're hoping to share information about these two topics. We'll also include a little bit of information around COVID-19 because we're still mentioning that even if we're not in a public health emergency anymore. So that is that information, and I can share more via email as well if I can get help from Latin 19 to share the information. And also if you go to our Facebook page, probably this afternoon, you will see some of these postings again. And basically people just go to the page, Facebook page, and the event will appear and people can tune in. And if we can move on to the next slide. So I'm sharing some information about campaigns that we have going on. The ongoing campaign that we have in English is Life is Calling, in Spanish is Tienes una vida por delante, is continuing to encourage people to stay up to date on their vaccines, and talking about testing and talking about treatment in the current way, in the current situation that we have. We know that vaccines are still available for free, and we know that it could change when the vaccines that are currently here are gone, the ones that were paid by the federal government. So whenever that happens, people can still access COVID-19 vaccines, but it will be through other ways, depending on their situation. if they are insured, or if they have Medicaid or Medicare, it would be covered by those. But for people who are not insured, it would be like other vaccines, like the flu vaccine, which probably has a cost depending on the location. So we continue to encourage people to stay up to date on their vaccines. And we have these promotional materials in our website. You can visit vacunate.nc.gov in Spanish for more information, or the English one as well. And we can move on to the next page. Like I mentioned before, we have, we're highlighting and celebrating Pride Month. And so aside from the cafecito that is touching on this topic, we also have a few materials that people can access available online, and you can also place an order for materials. If you're interested in English and in Spanish, we have some Take Pride Now Sexual Health Pocket Guide. So if you're interested, you can check out those resources online, or you can also, one of the easier things would be if you visit our Facebook page, you can click on the links and then land on those web pages. And I can also send this deck out with the links if people are interested. And we have Enorgullécete in Spanish and Take Pride Now in English. So we'll continue to promote this campaign, which is really promoting sexual health among communities. And we did see an increase in some sexually transmitted infections at the end of last year, beginning of the year. So we're continuing to promote this, but it is also an opportunity to celebrate the LGBTQ+ community as well. And another sort of campaign that we have going on at this moment is the 988, which you probably have heard about a few times. We have new PSAs in English and in Spanish on our YouTube and Vimeo pages that you can share, that you can promote. They're also available on our Facebook page, and we have information in Spanish. People can call and have access to support when they're going through a crisis in Spanish through the 988 phone number. And we can move on to the next one. Like I mentioned, information is available in Spanish and English. We have some posters, and we did put a call for organizations that were interested in placing an order to receive those materials in hard copy a couple weeks ago. So those materials already went out. And if there's anyone interested, let me know. I think that we already closed that deadline and materials were shipped out. But if there's anyone who really is interested, I can definitely ask to see if we have any leftover materials that we could share. If we can go to the next one. So I will just go quickly through some of this, because I know that we shared some of this information a few meetings ago, but I wasn't sure of the timing. So as you know, Medicaid expansion was signed by Governor Cooper back in March. And I guess the update that I want to share is that we have work groups within the department that were formed that included external and internal people, internal people to the HHS and external community partners that are part of the conversation to get ready for Medicaid expansion in terms of implementation. So we have an enrollment work group, we have communications, we have data, and one more work group that I cannot recall at this moment. We have been meeting, and we are trying to get ready with messaging and trying to get ready with the different, really the different areas that we need to think through as we get closer for implementation. I estimate, based on some research, that about 50,000 to 60,000 Latinos in the state will be benefiting from Medicaid expansion. It could be more, but that's some rough estimates. We also know that there is people who are currently eligible but are not enrolled. So the efforts coming soon on Medicaid expansion will give us an opportunity to do this type of campaign promotion that hopefully will reach other people as well, not just people that are recently gonna be becoming eligible for Medicaid expansion. So if you have any questions, if you have any thoughts, please feel free to reach out to me. Once we hit go with more details, and as we get closer, we'll be sharing more information and trying to keep everyone updated as much as possible. There's no date. We don't know yet when this could happen, but once the budget is passed by the General Assembly, it will be 60 days after for enrollment to begin. And so we're working on the back end, trying to incorporate as much as possible the lessons learned from COVID, and continue to engage with partners to really plan and be ready. If we can move on to the next slide. So just some highlights of who would be covered under expansion: low-income parents and low-income childless adults. And this is sort of the newer item that Medicaid expansion is bringing. So this could include low-wage workers, children who age out of Medicaid, women who would be covered if they were pregnant, and among other people as well. We can move on to the next one. And some services that we know that would be included under Medicaid expansion: primary care, prescription for medicine, behavioral health, maternity and postpartum care, among other services. And so we're really encouraging people to, if we can move on to the next one. No, sorry. I'm probably going to skip this one because we went over at the last one, and I can go back if needed. We really are encouraging people to try to see if they're currently eligible. Like I mentioned, there's people who might not be participating but are eligible on Medicaid. So the messaging is that people can apply online through ePass. And if they don't qualify now, they can qualify later. But this would help to make sure that we are gathering some of that information so that when Medicaid expansion passes, we can sort of try to communicate back and let them know about this change. We are working, the Medicaid team, the communications Medicaid team is working on updating an ePass sheet with more information. There's some updates and more instructions. And whenever that is ready, I'm happy to share back with this group to get your support to share it out with the communities that you're serving. I know that there is a lot of changes that we have been seeing and that will continue to come up. And I hope that we can continue to make space in these meetings to bring folks from the Medicaid team and to continue to bring as much information as possible, because people will have those questions and will be asking for guidance. And I know a lot of you are seeing people every day, and so it will be helpful for you as well to know the details. But that is what I prep on the deck for today. And Noticias newsletter will be going out either later on today or tomorrow morning with information about the cafecito. We're also promoting a community listening session. We are part of a working group out of the governor's office. A few of us at the HHS are participating on this work group, and we have a community listening session in Greensboro on June 20th from 5 to 7:30. And this is in collaboration with the City of Greensboro's Human Rights Department. So more information on the Noticias. If you are not currently subscribed, please make sure that you subscribe today so you can get this information. There is a registration. Interpretation will be provided in Spanish, and if there is a need for an additional language, we just want to make sure that we hear about that need before June 13th, so we can try to find those accommodations. And this is sort of the second listening session of this year. The first one happened in Charlotte a couple months ago, and I know Lat19 had a presence in that community listening session. So more updates will be on Noticias. Please let me know if you have any questions. We'll put the link on the chat again for people that might wanna subscribe. And thank you again